Hi, this is Tony Gualdo from Arthrex Vet Systems here with Dr. Helen Newman, the Director of Veterinary Transplant Services, a professional veterinary tissue bank. Welcome to our third podcast in a series about our partnership with VTS and the new biologic products we are now offering. Today we're talking with Helen about Fusion Xpress, an injectable bone putty. Welcome, Helen.
Thank you.
Helen, how does Fusion Xpress work?
Fusion Xpress is a unique product in that it's a combination of our OrthoMix bone allograft that we discussed in a previous podcast with a putty carrier. And the significant advantage of that is that it's ready to use. It ejects right out of the syringe. There's no glove handling of the bone graft material. And so it can be placed right into the site. It contains our allograft material, and also about 10% of it is also synthetic bone graft material that's radio opaque, so you can readily see where you've placed the allograft in postoperative radiographs. Another advantage of the Fusion Xpress is that because it's all contained within a putty, the graft stays where you put it and it doesn't wash away. So if you are a surgeon who likes to irrigate, do a massive amount of irrigation right before you close. If you're just using OrthoMix, you have to be careful about not irrigating, the bone graft that's not in a putty. With a putty, you can irrigate directly, even right onto the putty, and the putty will stay where you place it. So it's got a number of convenience advantages for certain.
What is Fusion Xpress used for in orthopedic surgery?
Well, it's used any place a bone void filler might be needed. So osteotomies, for example, or in fracture repairs. And it's often used in dentistry as well. It's used in places where it's maybe difficult to reach to put bone graft. It can be inserted through small, tiny stab incisions. It comes with a Luer slip tip syringe, and it ejects through that. So any place where you can direct the tip of a Luer slip tip syringe, you'll be able to place the bone graft material. And again, it stays where you put it. So those are some of the advantages of using it and where you might want to choose to use this. It's also pure convenience and very quick. So if you need to have some bone graft and you need it quick and you want it to stay there, Fusion Xpress is the choice.
So it's quick, easy, and stays where you want it.
Exactly, and can be withstands irrigation.
Is Fusion Xpress species specific, or can it be used in different animals?
Well, that's a good question, Tony. First, I need to introduce the concept of allograft, autograft, and xenograft. So an allograft would be a graft that's transplanted from one patient of the same species into another. So a canine allograft into a canine recipient. Autograft, everybody knows, is from the same patient. So if you take bone from the humerus, transfer it to the femur of that same patient, that would be considered an autograft. There's a third kind of graft called xenograft, where the donor is a different species than the recipient. So, for example, when our canine bone is used in a feline patient, that would be considered a xenograft use. Now, that happens all the time, and many surgeons just use canine bone in all of their patients. And I can tell you that there are quite a number of zoo animals that have canine bone allograft implanted, including things like harbor seals and porcupines and bobcats, wolves, etc., who have xenograft materials. There are a lot of studies that show that properly processed xenografts, where we process them to remove all of the cellular elements, don't stimulate rejection responses in the recipients and go on to heal quite well. And based upon our experience with this and what's in the literature, and in an effort seriously to bring the cost of our Fusion Xpress putty down from regular OrthoMix, we decided to have the source material for Fusion Xpress be equine bone. So if Fusion Xpress is used in a horse, it's an allograft. If it's used in a canine, it's considered a xenograft. It's used successfully. It's been being used for many years and works quite well in patients of all species.
And what about the handling properties and dose sizes?
Handling properties are the main feature of Fusion Xpress. It can be expressed directly out of the syringe that it comes in right into the site so that you don't have to handle the graft material at all. That's what makes it easy and convenient to place into difficult locations. The other thing is that if you want to, you can handle it. You can form it into balls or little logs and place it into bone voids. Another nice feature about the Fusion Xpress putty is that it stays where you put it. So you can smooth it into a site and then you can irrigate it and it won't go anywhere. So the handling is really the main feature. The handling and the convenience are really the main feature.
Excellent. Anything else you'd like to add about the Fusion Xpress products?
If you're trying to decide whether to use Fusion Express versus OrthoMix, I would say if getting some bone graft into the site is all that you really need to do in an economical fashion, Fusion Express is the way to go. Or if the convenience of getting it injected into that site is paramount, then go with Fusion Express. If you are looking to add maximal concentration of growth factors, I would say choose the OrthoMix. And frankly, it's just, a full cc of OrthoMix is a full cc of bone allograft. If you're using the Putty, in order to make it ejectable, some percent of that has to be Putty. You're not getting a full cc of bone when you get a cc of Fusion Express, but the trade-off is the convenience, getting that bone graft where you want it, being able to irrigate it, and having it stay where you put it. Fusion Express comes in 3 different dose sizes: half cc, 1 cc, and 2.5 cc. So there's a wide range of applications.
Thank you, Helen, for spending time with us today, and especially for sharing your expertise in the Arthrex goal of helping surgeons treat their patients better. If you're a veterinarian interested in learning more, please get in touch with us via email at csvs@arthrex.com or call our customer service department at 1-888-215-3740. If you're interested in more technical questions, feel free to call Dr. Newman directly at VTS, telephone number 253-520-0771. In our next podcast, we'll be discussing Synergy, advanced biosynthetic bone graft. Thanks for listening.